Gon' vote. Everybody gon' vote. Everybody gon' vote. Everybody gon' vote. Comrade! Labor right, them a go down, bang. Them a go down, bang. Them a go down. Is that? Margie, him a God picking. No hope their work if you touch Margie. Margie, him a God picking. No hope their work if you touch Margie. We now vote for Labour. Orange we a come out in now. If you love the PNP, who no step out for Marky G. Jamaica just come along with we. People time come, people time come, people time is up.
Only thing that's on my mind is who's gonna run this town tonight.
Yeah, I said that we are. Pledge your allegiance.
Who's gonna run this town tonight?
Yeah, I said that we
We gonna run this town.
The opposition is concerned about the decision of NRC and NEPA to withdraw prosecution against Tradewind Citrus Limited for the pollution of the Rio Cove in December 2023. We are particularly concerned because reasons were not provided for its decision to withdraw. As a body that is charged with protecting our natural resources, it is important that its powers are exercised in a transparent way.
South St. James. I want to give you a quick update on Hurricane Beryl relief efforts. First, let me address the allocation of funds for our recovery. Initially, the government allocated $5 million to the MP for Hurricane Beryl relief. Recently, an additional $4 million has been announced, bringing the total to $9 million at the MP's disposal. There is, however, an additional $3 million that is available for constituencies that are severely affected by the hurricane. Given the scale of destruction to our farms, our homes, and the economy, I think South St. James qualifies for this additional $3 million. This would make $12 million available to us. This, however, requires proactive and compassionate leadership to compile the necessary data and submit it promptly to make the case for South St. James. Unfortunately, the level of leadership is lacking in our community that will make this case for us. With the political maneuvering that we're seeing on the ground, this will place a hindrance for the effective distribution of aid and access to resources. Let me share with you two examples of how politics is being prioritized over the welfare of our people in South St. James. In the first example, we see where a councillor from the PNP, who is an engineer and a long-standing contractor for the JPS, he has been working tirelessly to restore electricity in our communities following Hurricane Beryl. He's assigned by JPS. This councillor has no discretion over which community he's assigned to service. Following professional instructions from JPS, he has been ensuring power is restored to communities in South St. James. Would you believe that the senior JLP representative in South St. James intervened, claiming that the contractor was gaining political mileage from his work? As a result of that, the contractor was pulled from his assignment and reassigned to another constituency altogether. This political maneuvering has left many communities in South St. James in the dark. So the people have been denied the essential service they need because a politician was uncomfortable. In another example, we are seeing partisan distribution of relief funds. Despite the allocation of $9 million for relief efforts, we've seen little brown envelopes being passed to JLP supporters instead of prioritizing those most affected by the hurricane. This partisan distribution of funds is unjust and is detrimental to our community's recovery. We have compiled a list of constituents, irrespective of their political affiliations, who have lost their homes, their roofs, and in some cases, their livelihoods through their farms or their shops and their business places. This list we've hand delivered to the Member of Parliament. We've also shared it with the local disaster committee in St. James. Yet, we have not received a response or seen significant movement towards providing relief to these people. Misallocation of hurricane preparation funds. From the initial $5 million, the MP allocated $200,000, he said, to each of the 3 PNP councillors. Despite these councillors having direct access to the people, $200,000 is what he has made available to them. To date, the PNP councillors have submitted the necessary invoices as requested by the MP, but they have not received any care package to get to the community, while of course the MP is out issuing his packages to the people who support him. We urge our Member of Parliament to adopt a developmental approach and to prioritize the needs of our people over political patronage. The people of South St. James deserve swift and fair distribution of aid, especially those who are most vulnerable and have been severely impacted by Hurricane Beryl. South St. James, we are a resilient people. We've withstood natural disasters and years of underdevelopment, but our resilience should not be an excuse to neglect us. The destructive politicization of the burial relief effort must end now. We call for a serious, comprehensive approach to identify those genuinely in need and provide them with the resources to rebuild their lives. We need visionary leadership that puts people above politics. Time come to bury. Cornwall Regional Hospital has become a symbol of the severe inadequacies and inequalities in our healthcare system, where patients are left to languish without basic care. 3 weeks ago, I visited a constituent suffering from serious diabetes-related complications who had been admitted nearly a week prior to my visit. Shockingly, we couldn't locate him on any ward, only to discover he had been sitting on a chair in the accident and emergency area for the entire duration, nearly a week. He wasn't alone. Numerous other patients were found on chairs, the floor, and even on cardboard. One man in severe discomfort was seen forcing his way through a hive of family members trying to see their loved ones with his urine collection bag and other medical trappings as his back was strained from sitting for days upright on a chair, he said to me. This past week, I was approached by a desperate family seeking help to find a bed for their mother in Kingston. This middle-aged woman is suffering from a brain tumor, and while she has insurance, still she cannot have surgery due to the lack of beds at Cornwall Regional. Fast forward 3 weeks after my last visit to Cornwall Regional to see about constituents, and my own father faces the same dire situation. He's a stroke victim, faced with no beds and forced to sit on a chair at Cornwall Regional Hospital. This isn't just about my family. It's about the countless Jamaicans who cannot afford private health care. I represent a constituency of proud, hard-working people, farmers, market vendors, public servants, good tax-paying Jamaicans. When they fall ill, who do they turn to? They cannot afford private care. Should they have to beg for a bed when they're sick? Should they play Russian roulette with their lives? Are we comfortable with the glaring inequality in our healthcare system? Can we confidently say that today for me, tomorrow for you won't apply to us tomorrow or today? Over the past week and a half, People from across Jamaica have been sending me voice notes, messages, photographs, and videos documenting the appalling conditions of hospitals and healthcare facilities in their areas and the treatment their relatives have been receiving. It breaks your heart to hear of the loved ones who have died on chairs, who have been refused surgeries due to the lack of beds, equipment, or staff. The 500% cost overrun from 4 billion to 21 billion and the 7-year delay in the completion of the rehabilitation of Cornwall Regional Hospital demand immediate accountability. The government must provide transparent explanations for these overruns and delays and take swift action to expedite the completion of the hospital's rehabilitation. No Jamaican should ever have to hear no beds available, sit on a chair. It's time for urgent and comprehensive reform in our healthcare system to ensure all Jamaicans are afforded basic human dignity. This is not just a call for change, but a demand for the basic human right to health care. Time come.
Anjo, me can't understand uno. Uno labor right people, me can't understand uno. Anjo, you can't find money to buy AC in a hospital. Anjo, you can't find money to buy a hospital bed. Anjo, you can't find money for the sick them in a hospital get a good plate of food to eat. Anjo, you can't find money to pay the non-criminal police them. Anjo, you can't find money to pay the non-criminal soldier them. Anjo, you can't find money to pay the teacher them. Anjo, you find money to pay the nurses and doctors them. But you can't find money to go pay 420 million for consultation. Just to sit down and talk to somebody who are wicked. Only uneducated people run behind you, Andrew Holness. Who are wicked. Only people who have nothing to live for run behind you, Andrew Holness. You are wicked. Andrew, you say you is a serpent. You is very wicked and evil. You don't care about poor people. You have to come out of Jamaica. You have to live up. Because if we not been riding like an Apache, we not feel so and we get too comfortable in a wicked zone and we come out of that. I me tell you no, we not live up out of Jamaica. We sick and tired of you.